As important as it is to advise patients why you are prescribing an eye drop for them, in other words, what you are treating, why it is important that they take their eye drops, etc., it is equally as important to counsel the patients on potential side effects of the eye drops, in this case, prostaglandin analogs. It's interesting that if you Google side effects of prostaglandin analogs, the first thing that comes up is call your doctor as soon as possible if you experience any of the following. And it goes on to list redness of the eyes, change in color of the eyelashes or iris or skin. I take issue with this because if a patient is properly counseled and advised that these side effects are normal and not serious, they should not have to call the physician's office if they experience any of these side effects. I can't tell you how many times over the years I've had patients come back and yes, they may have some of these side effects, they may have redness of the eyes in particular, but if they know that this is a normal side effect, they're quite comforted by that fact, and they will often say, "That's okay, doctor, I'm willing to accept some redness of my eyes if you tell me that this medication is working and that it is doing its job." Conversely, there will be patients, as we all know from our experience, where what you tell them goes in one ear and out the other. And over the years, I've had many patients come back to see me who, despite proper counseling, will say, "Well, I took the eye drop for a couple of days and my eyes were looking a little bit red, so I stopped taking it." And they haven't taken any eye drops for 6 months. Well, of course, this is quite infuriating for the physician and frustrating, really on two fronts. Firstly, because although I have counseled them as to the importance of taking the drops and what we are treating, obviously I didn't achieve that goal because they did not take their drops for longer than 2 days. And secondly, even though I counseled them that these side effects are quite common and that they are normal and that they should not be concerned, obviously that did not register and the patient did not continue their eye drops. So in my opinion, the take-home message really is that the redness is a normal thing. It's common, as well as many of the other side effects. And the patient should be reassured that they should not be concerned about it. And it's not a sign that the drop is not good for them or that it's causing them some serious problem. They should continue to take their medication. And as mentioned, as long as the medication is working and achieving the desired effect, the patient will often be willing to put up with a little bit of the redness as long as they know that it is not causing them any long-term harm.